Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable, presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way.
Yeah.
If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Speaking of reviews, at Cham Coffee 102 left us a very short and 5-star review recently. Fellow vet tech here in Illinois, love this podcast.
Woo, we love you.
The reviews really help. We cannot say enough. What you
cannot say
Illinois.
enough.
Both of them.
Illinois.
Yes. Reviews.
Apple Podcasts, especially Apple Podcasts.
Yep. Boost the algorithm.
In case we didn't say
Algorithm.
Apple Podcasts. Boost the algorithm. There you go. We have 100 on Spotify, 28 on Apple. Let's get to 35. If we get to 35, Duckwall will
Sing a song.
sing a song. There you go.
And I know what song it'll be.
Okay.
Because I sing it every day to Helen.
So only Helen knows?
No.
Oh, okay.
The world knows it's called a lullaby. A lullaby. Yeah. Okay. Anyway, on to today.
Yeah, see? That's the kind of day we're having.
Yep.
Go ahead.
Oh, I'm ready for this vent sesh.
Ooh.
On today's episode, we have myself, associate veterinarian and diaper changing expert. That's appropriate still. Dr. Ashlyn Duckwall.
I hope it's still appropriate.
Yeah. Oh yeah, she's filling up diapers every hour. We have our very talented young newly married veterinary technician Bailey. What's your last name?
Starks.
I say Murray.
Yeah.
I just can't remember their
Starks.
last names.
You're
Starks?
Iron Man.
You're Iron Man. Oh, we can call her that now. Okay.
Amazing.
Okay, I love it.
Congrats.
Our hilarious, free living, plant loving room assistant,
That's
Abby.
me.
And then the queen of all queens, the ruler of all star in the universe, Dr. Emily King.
Thank you.
Yes, queen.
Yes.
Yes.
So we decided to change it up for just a couple seconds.
We just couldn't go on to Icebreakers because we're not ready to have fun.
No.
Damn
We're
it.
just- Do you hear that? That's frustration.
We
I'm
need a
frustrated.
vent session. So
Yeah. You go first.
talk about your vents. Okay, you want me to go first?
Yes,
I got a
please.
list.
You got
of
it, you
things
got
to
it.
go. I am now. I'm like, okay, maybe I should suck it up and not talk about it. But you know what?
No.
That's not a thing.
Let
you
it
should
out.
really totally let it out
Yeah.
because you know what? People should really appreciate and you should share that
Yeah.
frustration.
Mhm. Yeah.
You know what I'm saying?
Because it's relatable.
Yeah.
It's
We're all
relatable.
feeling it.
Exactly.
Yeah.
Why
Yeah.
hide it? Why push it all the way down to your toes? Because
That's right.
that's not good for you.
Yeah. Where's it
It
gonna
makes
go?
everybody think you have your shit together and you really don't.
Why are you getting
and
a little
so-
sassy?
Girl, you're
Sassy?
talking about
No,
toes.
because
One
I
of
am.
my vent sessions is mine are tingling. Because why? My disc in my back hurts again.
Oh no!
Oh, no.
Yes.
You have tingly toes.
I have tingly toes. I have a degenerative disc in my back.
No.
Thanks to tennis. Hate tennis now. And now it's flaring up because I wanted to ride my horse to get stress out of my body and it flared up the disc. And now my toes are tingly and my leg is tingly and I can't bend over to pick up dogs.
That's very
it's so
frustrating.
funny. I'm so
It
sorry,
hurts,
buddy.
thanks.
I know.
Well,
That's
we've
my
been
vent.
struggling with IT session, IT
Mm.
IT
shenanigans.
Oh, I
Yeah.
have a heating pad on. I have cramps.
That's Abby's vent.
Happy Wednesday.
I interrupted your event session.
No,
so
no,
going.
you didn't.
Go,
No,
go.
I am just so frustrated because, you know, anytime you try to intervene and do something and then something's worse than when you started.
Mhm.
Like, you know, like don't intervene with the
Mhm.
stuff. Like leave it the way it was. It was fine. We were working. It was working. It was going fine. We were working at a good clip.
Mhm.
And then, no, we got to switch things over to whatever reason. I still don't understand the why because I'm a big like why person because then I can buy in. No, don't understand the why because if there's a disaster, that is why we have to be on remote connection because if there's a disaster like a tornado
Like
or
a
a
natural
flood or a
disaster.
hurricane,
Mm-hmm.
we can get our information back within hours instead of days. And I want to be like, okay, well, I'll plan for that disaster, which is never going to happen because we
In
live
the
in Indiana.
history of
I don't know when we last
All-Star.
had a hurricane or
Yeah.
a tornado.
So
Now
I
I'll
really
have one.
tried to
Or
buy
what?
into the why, but the more I was living with the why yesterday, I was like, this is a bunch of bull honky.
Mhm.
Whatever.
Yeah,
Like,
and it's frustrating everyone.
And this is going on day 7 now. And
Yeah.
I mean, it is just.
Let me tell
Well, then you got people in your ear being upset about how slow it's running. And then you're like, I already have my own frustration.
Yeah. And
She's
then we look
yelling down the hallway.
incompetent to people. And
Mhm.
then because the building's very big, so we use Vocera. We've talked about Vocera before. We love Vocera. Vocera
Yep.
keeps us all connected. And when you don't have it, I just started yelling down the hallway yesterday.
Yeah.
Oh, yeah, you were yelling
I did.
for me.
I was like,
I was-
Elise.
Yeah.
And I'm like, send Bailey. Yeah. I mean, I was just like, I'm over this. This is
Yeah.
ridiculous.
Because even using your cell phone, it's like, I left it on my desk. I got to go get that first. And
Mhm.
And then we were using a walkie.
Yes.
And we were on certain channels, and a client was walking up front, and Penny's walkie goes,
Oh no, I don't want to say it.
say it.
Beep, 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 beep. It got interference probably from construction,
trucker,
probably
construction.
the bridge working down here, and it was just kind of like a couple of F-bombs. And Penny's like, "Have a great day," and I'm like, "Penny, turn your walkie off, please."
oh, poor Penny.
Yeah,
Oh,
Penny was like, "It's my entertainment for the day," and I'm like,
No. Bless her
So
heart.
that's where we are.
And I'm
with
like,
the
this
lockdown.
is speaking against all of our core values.
right.
Yeah.
It looks
Yeah.
doesn't look good.
One of our core values is being skilled.
Yep.
We are not, and reliable,
Mm-hmm.
and accommodating, and loving, and loyal, and what am I
Timely.
missing? Timely.
We'll make it
Plus
happen.
these coffin dogs out of the
God.
woodwork.
Oh my!
Oh my God. Yes.
Yeah. They're awful.
Mhm. Yeah.
They're awful. Nobody wants to treat them anymore because they're
I can see
coming
their
out of
rage.
everywhere.
Everywhere.
And then some are responding great, some
Just-
aren't. We just had to do a test of the airways on Monday. The dog has mucus coming out of everywhere. It's just
Oh.
like,
Yep.
it's a lot.
Mhm.
It's a lot.
And owners don't understand
Mhm.
that even though the bronchopneumonia's gone, they still may cough.
Yeah.
They may still cough for 10 to 12 weeks, but the dog is not dying. It is okay because we took an x-ray that shows that it doesn't have bronchopneumonia.
Yeah.
It is fine.
Yeah.
Yes, it is.
We're doing what we can.
Yes.
Okay.
Yes, Queen. But
Yes,
You're
yes,
getting it out.
Queen. I'm getting heated.
Oh,
Literally.
I am too. I gotta turn this thing down. I think it's on a high. I don't know.
My toes are tingling when I cross my legs.
yeah.
I can't
Make sure you
Don't
get
cross
my
your legs.
blood flow.
Oh.
With your toes constantly.
Ugh.
What is that?
So, yeah.
fine.
Okay. Well,
All right.
whatever.
Do you feel better?
No.
Ugh,
Mm.
I kind of do.
Okay. Well, that's good.
Yeah.
Yeah. It's just, people should know that we may seem like we have all of our shit together.
Mm-hmm.
Oh, but behind the scenes,
We're trying.
we run around like
there are
trying to
days.
head
There are
stuff.
days when it does not feel like so.
If there's 2 empty seats at the next podcast, is because we went on vacation.
That's what we said.
We just decided.
You took Bailey and I on vacation. That's so nice of you. Thank you so much.
Sure, yeah,
Oh,
4
thank
empty
you.
seats.
4 empty seats. There we go.
yeah.
I
tried. Okay.
So, if any of you out there are struggling, just know
You're not.
We
you're
all
not
are.
alone.
There's a full moon next week, by the way.
Oh,
no!
I'm so-
now
I
there's
had to.
Mercury in retrograde.
I don't know where it is, but it's not aligned. It's not
It's
proper.
retrograde. It's
It's-
something
Is it on
funky
a Friday
weird.
too? Let me
Probably.
guess. On Friday
Yeah.
the 13th. We're not even close to a 13th.
Okay,
yet,
good.
but still.
Oh, you about had
Full moons, they bring out all the wax of people and animals and
Yeah, the animals know.
mm-hmm.
Yeah.
Oh.
But I think it's just it is what it is. People
It's
are
all right.
cranky, and I'm not a cranky person, and I don't
Mm.
deal well with cranky.
No, you
don't.
don't. You
I
get
shut
frustrated
that-
with yourself
I
that
shut that
you're
down.
upset.
Yeah.
Mhm.
Yeah.
Yeah.
It's okay that you're not strong all the time. Feel your feelings.
It's okay to not be okay.
Yeah.
No, it's not.
Yep. Okay.
Okay, I don't know how to help you.
All right, let's move on.
Let's move on. Well, we already went through how we're doing, so let's just leave that there. Okay. Hey, love the podcast. Thanks.
Thanks.
And always look forward to listening on my way
Until
to
today.
practice.
No, I'm just kidding.
Y'all got weird.
We got dark. I'm an aspiring vet nurse, but can't start college until I can be well enough 5 days a week. I'd really appreciate some migraine tips, please. Oh, this makes sense.
Oh,
why
this
I'm
is
going
Amber's.
to migraines.
Yeah.
I don't know how to. Labiba? How do you say her name?
Labiba?
Labiba Rahim?
Yeah.
Okay.
I like that.
I'm so
That's
sorry if I botched her name. I really hate if I do that to people. Okay.
Cool name.
So here are some tips. I believe they're from Amber, who was our nurse on here last podcast, who also suffers migraines.
Mhm.
Keep a kit with any medications that you may need on hand and stocked. Example, pain medications, anti-nausea, etc. While it may seem silly, finding hands-free heat-cold packs has been a lifesaver. Cue in Abby wearing one of those for her belly. I have a couple that go over my wrist like a bracelet and one that uses Velcro to wear around my neck or head. This allows you to do treatments and alleviate some of the discomfort. While it can be difficult to do in our profession, avoiding loud or bright areas, if you are unable to avoid these things, as is often the case, adjust what you can, changing screen brightness and turning off blue lights on the computers, wearing earplugs. I'm very blessed to work with a team that's understanding and willing to help my running to get patients for me or willing to let me hide out in a quieter area until help is needed. Cue in Dr. King smiling because she just helps people. Okay. Highly recommend being open about your migraines, even if it's just one person, because they might be able to help you come up with a way to get better through the day or cover if you need a few minutes. If you're willing or able to invest in them, there are some devices that you can look into as well. If you find it helpful, there are devices that will push on different pressure points. Or there are, this is very interesting for myself as well.
Yeah.
Or there are more direct devices such as Cephaly or Neurovivo, I don't know, which are neuromodulation devices. Cephaly, I'll just spell it. Cefaly treatment takes about an hour, but usually helps enough that I don't have to miss a full day of work, just 1 hour. No, all of these will work. Not all of these will work for everyone, as everybody experiences migraines differently. There will also be days where the migraine is truly debilitating, but these things help make them less frequent. I hope this helps.
Very helpful.
Amber.
I suffer from migraines as well, so I know the feeling.
Mhm.
But I'm really light sensitive, not audio sensitive. So I'm looking at getting prescription glasses that are tinted.
Nice.
But I also normally keep sunglasses with me just because there's a lot of lights around. But
Okay.
yeah, I'll just pop those on for a little bit and be fine.
There was
One of my clients told me that if you just breathe oxygen, it really helps.
That too. If you sit in a dark room
straight
with
oxygen?
oxygen.
So go into a
Mhm.
clinic and then sit next to your oxygen. Make sure the ISO's turned off. But
I think Amber's done that as well. It's like she's
seriously,
taken
like,
over.
no, they say pure
X-ray
oxygen,
Venet,
like
yeah.
it's supposed to
Okay.
something or something, and then something, and then you're
It gets the blood flowing.
Wow. Yeah.
My mom also has terrible migraines, and one of the treatments is Botox in the scalp.
Mm-hmm.
So she got insurance covers it too.
seen
So
that,
she'll
yeah.
get treatments up here,
Yeah.
which I'm
I'm
sure
just-
have nice side effects with.
I'm too
wrinkles
scared
but
of needles for that.
She
to
says
happen,
it helps
but-
her, but
Yeah.
she still has debilitating ones.
Mhm.
So
I feel like if it helps, it helps, and some days are going to be worse than others.
Mhm. Yep.
and there's always marijuana.
This is where you do.
You can't do that. At
Do we
work.
have to turn her mic off this podcast? Only on Friday.
This is where we speak fast in a low voice. Please do not use these things as primary care. See your doctor for advice.
do not perform this at home. Remember, like on the commercials, where it's like,
we need a little disclaimer.
Do not
Yeah,
Side
exactly.
effects may
Side
include death or
yes, death,
Like-
convulsions,
all these
loss of limb, aroused.
tingly toes.
Numbness in hands.
This
or legs.
drug will save your life until it doesn't.
I can't.
I love those commercials. So I'm like,
Then you're like, wait, what?
What?
Can you repeat that?
like I totally need to try that drug, and then you're like, never mind.
You can help with my migraine. May cause death. No.
Oh my god,
What
absolutely
just
hilarious.
love it.
happened? I don't
I-
know.
You
Oh,
never know
marijuana.
where this adventure takes you. You just ride along with us.
It's a tissue.
Oh my god,
Float along like a lazy river.
That's right.
just
Oh,
float.
that's
Exactly.
so nice right
Or a
now.
wave pool. Some days it's like a wave pool.
That's right.
Really
yeah,
rocky.
we could really equate a vet clinic to a water park. You
We
got different
could.
rides.
We
Oh,
totally
man.
could.
Okay. Icebreakers?
Sure.
Okay. You go for
Cereal soup.
it. No.
No. I
Do you heat up your cereal? That's called oatmeal, and that's not a soup.
That's mush.
It's mush.
And if you just want a piece of your soup, you can't just open the can and take a noodle out. Like if I just want a piece of cereal.
Do you
But-
eat just
but
one
then it
noodle out of your
brings-
soup?
You gotta find a reusable can lid, and you gotta put the
Alphabet soup. Get the A. Get the A. Somebody grab the A.
yeah. If I want some cereal, I can just reach in the bag and like put it back up. If I want some B's for my alphabet soup, I gotta open that sucker up and dig in there. No, they're not. It's not the same thing.
I can just imagine being, I really like a chicken noodle today.
But then that
I'm
brings
gonna
up the
open a
question of
can
like,
and go diving for a nude.
like is macaroni
I like noodles.
it's macaroni and cheese a soup though? Then that brings up that question.
No. It's a
There's
casserole.
not even a debate.
It's
a
a-
casserole.
I turned it off.
What, do you just bake your mac and cheese
If you
every
bake
time?
it.
I do.
No, mac and cheese is pasta.
But pasta can be soup too.
With
broth
Oh,
in
no,
it.
it can. I make lasagna soup and it's super good.
You gotta give me that
Oh
recipe
gosh, now we're
On to food. I still have got to order us Kilroy's. I got to do that next
Yeah.
Wednesday. Please remind me.
Are you getting breadsticks?
Yeah.
Yeah.
We talked about that
Mhm.
last
That's what we
Nice.
talked about last
Mhm.
time.
Mhm,
Yeah.
mhm.
Gotta do it.
Okay, is it acceptable to recline your seat on an airplane? Absolutely.
Yeah, especially if it does.
Yeah. Yeah. Because if it don't,
That
that
half inch.
sucks.
That half inch it reclines. You're like, recline.
It really
Recline.
Because sometimes
Recline.
you're like, oh, dang it doesn't recline.
Yeah.
Delta.
Yeah.
I've only flown one time, so I don't have an answer for that one.
One
it
time in your
Yeah,
life?
I'm flying for the second time in September, so
Well, there you go.
Godspeed.
I've only flown one.
Make sure you get a seat that reclines. 'cause
Reclines.
It makes a difference.
Yeah.
I think
Don't
we
fly
will be-
Spirit because I don't think they recline at all.
I think we're flying
Oh,
Southwest, but
gosh.
I don't know.
You know what's funny is it like barely reclines, but you can just feel the anger from the person behind you.
Yeah.
You're just
Because
like,
Spirit
sorry.
has these like
Yeah.
minute, like miniature tray just to have a tray to,
Yeah.
to be a tray. It's like this big, and then it like reclines, and it's like,
in your abdomen.
yeah, exactly. Oh,
Have you seen the new airplane seats they're coming up with, where it's like up here, down here, and up here?
Did you see the new
Oh,
airplane?
no.
It's like this. It was this big double decker thing, and it took off. It's like the world's biggest airplane now, and it
Oh,
was
I've seen that.
scary.
Mhm.
Get that thing out of the
no.
sky.
But yeah, now the seats are supposed to be like this, this, and this, and I'm like, I don't want somebody sitting up on top.
Yeah, because if
No.
somebody poops,
You're
that
done
fart's
for.
going into your nostrils, and then you
That's one way
recline
to look
and
at
you're
it.
screwed.
You
it
recline and they're
acceptable?
laying
Yes.
on top of you.
Yeah.
No, don't like that.
I don't like that at all. That makes me uncomfortable.
Yeah, I don't like it.
I saw that. I didn't like it.
Mhm.
Okay.
if you have to give up either dessert or alcohol for the rest of your life, which would you choose?
Maybe ask us on a different day.
Well, I got my answer because I'm not old enough.
Oh, yeah.
Mine's alcohol. I could live without it. I've lived without it my whole life.
Oh, I thought you were gonna be like, no, I have to live without. I thought you meant the other way.
No.
I was like, oh
No, I have to have a dessert like after dinner, like every day, like ice cream immediately.
is ice cream
No.
soup?
No,
No.
Okay, all right, I tried. I tried.
I mean, I'd probably give up dessert, and then if I wanted dessert, make like an espresso
That's
martini
exactly
or
what I was
something.
thinking. Is like I will
There you
drink my
go.
dessert,
Or beer
baby.
milkshakes. Have you had one of those?
No,
Those are good too. I don't know where I've gotten them, but
There was an ice cream sandwich beer at the fair this year.
oh, there's a
made that?
Neapolitan milk stout.
Yeah.
That's real good.
Ooh,
It's really good.
that sounds kind of gross.
No, it's good.
Okay,
I'm gonna have to try that.
Mm-hmm.
Okay.
You can get it
over,
at
though.
the
well,
normal alcohol store.
No, but somebody's got to have it. She's had it.
Yeah, I think you can get at it. I think it's not like that. Like, you
Beer
can find
night,
it.
Friday night.
Yeah. Yes.
my
2 more
water.
days.
Yeah, mine would totally be dessert because I would drink it. The
Yep.
dessert.
I don't like the taste of alcohol. I want cookies.
Cookies.
Don't choke.
That's what we do to Helen. We go cookie, cookie, cookie.
Is that why I get this party? You cookie, cookie, cookie. That's how I'm gonna say it now. See?
Oh, gosh.
All right, case collections.
Who wants to go first?
King.
Let me tell you about my coughing dog.
Tell
No,
us.
I'm not. I'm just
Dogs.
kidding.
No.
Oh, yes. I'm doing my
Yeah,
update.
just do that.
So, Papilloma dog was the boxer, 2-year-old boxer that had immune-mediated meningitis that was being controlled with cyclosporin and prednisone. Then, unfortunately, developed canine papillomavirus, or got exposed to canine papillomavirus, then developed papillomas. But he developed inverted papillomas, which have to be surgically removed. They don't respond as nicely to just like spontaneous regression. So he was up a creek without a paddle.
Yeah.
So what we did was and I'll take this case any day over these freaking coughing cases. Okay, but anyway, what we did, lowered the cyclosporin, because cyclosporin is notorious for preventing the canine papillomavirus from going into remission. So, which I didn't know, but it is. And so we lowered the cyclosporin and actually took him off completely. With Cross's help, we took him off the cyclosporin, lowered his prednisone dosing, and actually used azithromycin on him as well. Then also, oh, by the way, side note, he grew a fungus on his culture.
What?
So then we had to treat the fungus
Oh my god.
on his foot.
On his toes?
Yeah, which has only been documented. Like it's not a common fungus that you find in skin. Anyway, so of course he had it.
Yeah.
Because he's got all these
Obviously,
immunocompromised drugs. And so we treated that with fluconazole. Then came back around after day 3 to 4 of fluconazole and added Aldera.
What is that?
Yeah.
Yeah. It's a topical medication that people use for warts.
Oh, yes, I've prescribed that. It's funny because it's like
Interesting.
for
It's got a different name. I just can't think of the other
Yes,
name. But Aldera is how I remember it. But
it's like for genital warts in humans. And that's why I laugh when I prescribe it. I'm like, don't be alarmed when you go pick this up.
The
But
pharmacist is going to look at you kind of weird.
yeah.
so
let 'em know
we
for your
we
dog.
started and after just a week off of the cyclosporin and on the antifungal and then starting the Aldera, he looks better. I haven't rechecked him. I'm not yet at the 2-week recheck, but
Wow.
praise Jesus, he looks better.
Jesus.
He's only
So-
2.
He's only 2.
Oh my
Oh,
goodness.
Good for those owners sticking with it.
I
Yeah,
would've
That's
cried.
a lot.
I mean, she really was considering euthanasia because she was fearful that he wouldn't be able to live without the drugs,
Right.
for his immune-mediated meningitis.
Yeah.
So he is right now. So
Okay.
Fingers crossed.
It's a
fingers
win.
crossed. It's a win. Put it in the win column.
Nice.
Yeah.
Woo,
So that's
woo.
my update. So
Good job. That's very interesting.
I'll see if I can find some pictures too of like, I know
Oh,
McDivitt
yeah.
has pictures of
She
it
sent
before.
pictures, yeah.
And then once we resolve it, then
Ooh, yeah.
Be
that'd be kind
interesting.
of cool.
Yeah, that's interesting.
Side by side.
Okay, mine's a 1.5-year-old kitty cat. I first examined her in February for this issue. So the owner's concern was her third eyelids were elevated in both of her eyes, and it just kind of came out of nowhere. But it had happened one other time before I examined this cat. So on exam, by the time they got here, the third eyelids were lowered, and the eyeball itself, actually one of the eyes had some conjunctivitis, a little bit of redness, chemosis or swelling. So we treated it with a topical antibiotic, and she had been doing great on that. And we had discussed, okay, maybe the third eyelid elevation was secondary to eye discomfort and pain. And the origin of all that irritation could have been bacterial or potentially viral. We did talk about feline herpes virus. So she had done well. I honestly hadn't heard from them up until last week. She called again and said that both of the eyelids in the cat's eyes were spontaneously elevated. And the cat had been acting completely normal. Eating, drinking, playing, all that stuff. So she actually brought the cat into us for a drop off for us to monitor the cat. And the intraocular eye exam that I could do, even around the eye, was completely normal. I didn't see any of that swelling from last time, irritation. So the kitty cat got a little spicy with us because she was here throughout the day. So we weren't able to facilitate a temperature or anything like that, but she had been acting normal. So we did that brief exam. So I kind of started looking into like what is going to cause this like spontaneous elevation. Well, there is something called Hawes syndrome in cats, and it literally is that. It's spontaneous elevation of third eyelids. And it's called Hawes because it originates from what like horses have. They call the third eyelid that in horses. It can be a result also of GI disease, so viral or GI parasites. But this cat still, the whole time we had talked about this, did not show that issue. And so it's one of those like, well, it could be that where it's just idiopathic. We don't know why, but the result of Hawes is that it will spontaneously regress and go away. Well, that doesn't really fit with her timeline. So that was a Friday when we saw her. She ended up having to take the cat in on Sunday to an ER clinic because the cat became anorexic, not eating, not drinking, febrile, just not doing well. And so at the ER, the cat had a 104.7 fever. The ophthalmologist actually was able to examine the eyes because that was our next step. And he did see some uveitis or swelling in the eye. Inflammation of the components of the eye, I guess. So he started a treatment topically for that. It could all be tied together. Uveitis can be tied to systemic illness and her fever. She got vaccines on Friday, so it could have been due to that too with her fever not acting well, but that's usually only 24 hours. So we don't know right now. We don't know why she's having this, like, these weird elevations. Is it tied to like an underlying viral issue that she has, or is it GI stuff? We were going to deworm her just in case she had parasites. So yeah, jury's out. We'll see.
Interesting. Yeah, it was interesting.
It's
How
just
old did you say she is?
only 1.5.
Oh,
Yeah.
Yeah, it's really interesting because it's just weird.
Mm-hmm.
Yeah,
Yeah.
always, it does go away on its own, but it's just so strange to see because it looks like they're sedated.
Yeah. She
Or
sent
something.
pictures. It literally is like covering almost all her,
Mhm.
the front of her, which is freaky to the owner too. So
Oh, yeah. And you said it's Hawes?
Hawes, Haws. That's what I have on my list anyway,
like,
but it maybe for her it's not with the
Could be
fever she
anything.
had, but yeah.
Interesting. Wow.
Cool
I didn't know
case.
that. Yeah.
Yeah.
What about you guys?
I'll go.
Please.
Mine's he's like a 1.5-year-old or just newly like 1-year-old. Male neutered, little like Yorkie poodle mix thing. It's one of our employees' dogs. His name's Earl. He's really sweet.
Oh, Earl.
Mm.
But prior to his neuter, so she started me all the way at the beginning, just so that I had everything. But prior to his neuter, when he was like 7 months old, his ALT and his pre-anesthetic blood work was elevated slightly, like the most minuscule amount you could get. And then post-neuter, he occasionally vomited bile, like if she wouldn't feed him fast enough. And then in January, he had a vagal episode. So he was playing outside, then he like vomited and went vagal, which just basically became ataxic and like
Fainted.
Yeah.
Fell over.
Yeah, they didn't know what happened. And then when he came in, he saw Dr. Jones, and he had an arrhythmia. And they kind of just did blood work there. He had a slight elevation again of that ALT. And then a week post of the vagal symptoms and episode, they did blood work again. The ALT was within normal limits, and the arrhythmia was gone. Like, they don't know what happened. And then in April of 2023, he saw Dr. Dudley, and he still had a slight elevation in his ALT and occasionally would vomit bile. So Dr. Dudley started him on Pepcid for acid reflux. And then he saw Dr. Faust in June of this year, and he vomited bile. So the reason why he presented was because he was vomiting bile and vomited like a lot one night. And so he came in with Dr. Faust. So Dr. Faust was like, let's go ahead and do Proviable, Prilosec, and ID low fat and discontinue the Pepcid. And we'll do blood work as well. So ALT was slightly elevated again. And then he was presenting as like GI sensitivities. So they were trying to figure out what was going on there. So Dr. Faust also recommended sending out a Texas A&M panel for GI. I don't even know what it tests for. It's everything, basically.
Right. Yeah.
And then bile acids. So they looked at, she just wanted to look at liver function, see what was going on there, but also look at GI panel as well. So then it basically turned into his GI problems were turning towards poor liver function. So then Dr. King did some ultrasounds on him, and they came back unremarkable, is what Sydney told me. But he's had significant improvement on the meds and everything like that. So they just are kind of thinking that it's a liver shunt or a possible liver shunt. But she's going to go to VCA for a CT scan to see what it could be.
Oh, good.
That's probably what it is. I mean, his bile acids are too high. They're like 90.
Yeah.
Oh, then,
Can we
yeah.
explain what a liver shunt is? What
It's
You
a
said, what is it?
what is
yeah.
it? Yeah. What is a liver shunt?
it's a vein that when they were
Sorry, Bailey.
puppies, they had them. And it's like a vein that just goes straight to the liver, right?
Well, it's just like a shunting of blood away from the liver. So like
yeah.
it didn't close, or it's an
I see.
extra
close for-
highway.
oh.
Yeah.
I don't know how you want to think about it,
Yeah.
but I mean, they can have them inside the liver and outside the liver, and they can be really hard to diagnose on ultrasound. So it's just much easier to have a CT done to find. And sometimes they can have more than one. So it's just easier to, if you have a very experienced radiologist, they could maybe find it on ultrasound. But even then, I don't think that they would be willing to say with
This
a bile
is
acids of
exactly
90 that I for sure don't see it. I think that they would probably still have a CT done.
Yeah.
And he's a breed that can.
Yeah, they're
is
prone to.
common, yeah.
He's really cute though.
He's
Super
Yorkie,
cute.
isn't he?
And he's nice.
He's a
yeah.
Yorkie, like a
Yeah.
Yorkie poodle.
Oh, you had mentioned that,
thing.
yeah.
He's a
Yeah.
baby.
Yeah,
He's
he's really cute.
I don't have a case. I came very unprepared. I don't feel like I've
No
started.
worries. We're
or
going to
started
talk about a
anything.
case.
Yeah.
So we're just
Good.
But I do want to mention just real quickly, I have a 15-year-old male cat at home. He has diabetes. He's been on Silencia for 3 months, and I'll tell you, it's like given him a whole new life. He is
Aw,
running around. I mean, he sounds like a bowling ball, like going around through the house. It's amazing. So
that's
Silencia
awesome.
is
if your
great.
cat's uncomfortable, there's comfort for them. You just have to come to your vet. And I know it's scary to bring a cat, but it'll make them feel better.
It's worth it.
Yep.
it's worth it for sure.
I need to start my cat on it.
It's great.
Yeah.
Mhm.
I'll come to your house and do it. Oh,
Okay. I did have
Silencia van.
Yeah, because you do it like once a month. It's for arthritic
Mhm.
pain. Side effects, they can have some vomiting within the first 24 hours, but
Yeah, it's pretty like.
I haven't seen anything.
after.
I've used it on my cat too, but I haven't seen anything.
Me
Like,
either. Yeah.
we do need a Silencia van.
that would
Let's
be
just go
fun.
around and give cats Silencia.
I feel like
Is
we
your
have a
cat over the
couple-
age of 10, 12?
Here's some
Here's some
Silencia.
Silencia.
My one of my friends, she's in Canada. She just had to get her dog x-rayed for limping and stuff, and they found some arthritis and stuff. She sent me the
Librella.
yes.
Yeah.
And she was like, "Have you heard of that?" I was like, "Yeah, we want to use it. We just don't have it available yet." So apparently they have it readily in Canada.
Of course they do.
Oh,
Yeah.
I'm real
Is this
excited about
Silencia for
it.
dogs.
They have it in
Yeah.
Europe. They
What
have
is
it
it
in
called? Librella?
Canada.
Librella.
Mhm.
I'm excited about it because
I'm giving it to Pickles.
When do we get it?
Oh,
Come on,
Pickles.
It's
Pickles.
supposed to be like, I mean, anytime the end of this, like, I think last quarter. I mean, I think they were hoping to have it to us by fall.
Come on,
Is it
So-
just like what FDA
It just has to
regulation
be
crap
approved
or
and-
what?
I don't know if it has to do with production now at this point. I'm sure
Oh.
it has to do more with production.
Gotcha.
That's awesome, though.
Then
FDA stuff.
I have a feeling they're going to, they're going to, they're just going to burn through it. I'm
Oh
sure
my
they're
gosh.
probably making sure they have enough
Yeah.
before they launch it.
Yeah.
I'm excited. My dog's only 2 and she's overweight though, so she's gonna need it eventually in life.
Yeah. It'll be super helpful.
So it's gonna be
Yeah,
nice.
Pickles is on Rimadyl right now, but then every time I give her Rimadyl, she is like, because
What does she sound like?
thank you. It's horrible. It scares everybody. She does it like you'll be sitting around the dinner table, and then she goes, doesn't she hear it? So she goes,
It's not right when you give it to her. It's like
no, it's like,
after.
yeah, it's just like if she's on Rimadyl,
Yeah.
she does this. If I don't give her Rimadyl, she does not do it.
Oh.
Harrison, it's impressive, isn't it? It sounds like a person.
She's so little. What is that? Oh my gosh.
And so it's
You're just
really
eating
funny.
dinner.
Yeah.
Yeah, yeah, it's exactly what she does.
Oh,
It's
Pickles
just-
got Rimadyl.
She's laying on the ground and she just goes,
Oh my god. Shout out to Pickle.
I need it for Frank. He's on JD and Rimadyl.
Oh,
so
Same.
I
Frank
just
needs
need
it.
to help him.
Oh,
Yep.
buddy.
Poor guy.
Shout out to Todd in Canada. What up, Toddy? What? That's the dog.
okay.
That's my best friend, Tony.
Tony. All right, on to listener questions. On to listener questions.
Mm-hmm.
All right.
You want me to read?
Mm-hmm.
Cheat.
Hi, my name is Madison Rodriguez. I was told to email you from TikTok. My username is Madison __. I own a 2.5-year-old Rottweiler. I'm not laughing at you, Madison. I'm laughing at myself. Okay. 2.5-year-old Rottweiler named Dexter. Dexter has had extensive testing, and he is now at the point where, let's see here, where I'm lost in my paragraph here. We've done extensive testing, and the only other thing we recommended was a biopsy surgery, giving him WD from Hill Science Stat, which we've been doing, but it doesn't seem to help his diarrhea. It's persistent. His GI panel came back clear, and he was put on budesonide recently with little effect other than the side effects, including increased urination and drinking. I could send photos if needed. blah, blah, blah. Let's see here. I am very curious to see what you think, as his biological brother has the same problem. Okay. The veterinarian owns the biological brother, has found food that works for the biological brother.
But not for Dexter.
Please let me know what you think, and if you need any more information. Maddie Rodriguez.
Okay. So let's kind of go back. The main issue is diarrhea, correct? Is that what we have read?
think
Yes.
Okay.
Yes.
So what do we think about chronic diarrhea in a dog? Not fun.
Not fun for the veterinarian or the owner.
Right. I feel like a couple
Or
of
the
our
dog.
techs have been dealing with that too.
Yeah.
So,
So what are, I guess, break it down. What are some problems that can cause diarrhea? Chronic diarrhea.
Inflammatory bowel disease.
Yeah.
Mhm. Untreated parasites.
Diet.
Yeah.
Diet.
Diet, food allergies
Yeah,
sometimes.
allergies.
GI lymphoma, not as common in dogs though. So you put it on the list because you have to. That's
Yeah.
what I usually say.
Yeah.
Dysbiosis.
Pancreatitis.
Pancreatitis.
The old pink.
Oh my gosh,
Is that like
EPI,
a- EPI.
Oh, yeah. EPI.
Addison's.
Mm-hmm.
We're on a roll. Keep going.
So this is diarrhea. This is everything under diarrhea.
Yes, ma'am.
And if you add vomiting, it gets longer.
Oh.
it's pretty fun, isn't it?
No. I own a cat.
Okay, so they've done some tests and they can rule out some things. So pancreatitis or EPI would be things, it sounds like, from a normal GI panel.
Mm-hmm.
Obviously, diet sensitivity. I guess we can't rule it out because he just hasn't responded to it. So,
Yeah, you'd have to do an extensive food trial for that.
well, and I think if they give WD,
They probably,
Probably
have.
have.
Yeah.
right? Or if they've done, I don't know if they've done HP.
Yeah.
But yes, that diet trial is what you have to do and stuff. So what are our thoughts about this?
Well, I mean, I read through this, and one of the things I thought is, gosh, I would love nothing more than to be able to help your dog, but it is very difficult to offer an opinion when the pet's not in front of you. So there are so many things that go into creating a differential list. Yes, diagnostic tests are part of it, but then having the patient in front of you is part of it. And the way our brains work when we're looking at how we diagnose, and we just did a rounds thing on this with the doctors, but we, basically kind of have boxes that we check. And so, to Dr. Duckwall's point, as she was talking about, like, okay, well, we know this test is negative. We know this test is negative. We know that. So like we can eliminate things, but then there are still a lot of things left on the table. But having the patient in front of you would allow you to be able to potentially offer a better opinion.
Mm-hmm.
I think the one thing that I think all of us would agree on is that when, in this situation, we would say that you typically work from non-invasive to invasive tests. So you do all the things that you did initially and you're working your way through those tests. So you start non-invasive and you go to invasive. And as you work your way through it, you're eliminating the differentials on the differential list. Well, then you get to the more invasive test, which would be the biopsies. I mean, and that potentially would give you your answer. And unfortunately, in some of these cases, you have to keep looking until you find the answer.
Yeah.
That you can throw stuff on a wall and sometimes it'll stick, but sometimes it doesn't. And so when you've tried dietary therapy, and now, again, that's a non-invasive test, if you will, because we see how the pet responds to that food trial, then you're left with biopsying. So I think potentially going back to the specialist and allowing them to continue to work through the case, you're going to be best served by doing that because they have all the information and they're whittling away at their differential list. And sometimes they're not the best at like talking through all of it, because, and this is not an excuse, but everybody's really under pressure in terms of caseload. And so they are going through things rapid fire probably. And so it may feel like they're not giving you their deserved attention, but I still think that you can count on the fact that the medicine is good. Yeah.
Yep.
Yeah.
And it's normal to walk through different things. It's not like, the litter mate got lucky and the diet was responsive, but I mean, you also can't look at them and say it's the same disease. You just, you don't know that.
Yeah.
It's ironic. Sure, it could be the same, but obviously you can't do a direct connection like that.
Yeah.
So it gets frustrating, it gets expensive, especially when you don't have the answer after the first test. But
Yeah. And I think that they, we always, we think of normal tests as like they're normal, but it tells you what it's not,
Right.
so they are very valuable, even though they're normal. I mean, you don't have your answer necessarily, but I can tell you all the things that it's not.
Right.
And that is just as valuable as being able to tell you what it is.
Mm-hmm.
So when we're working through cases like this that are very frustrating.
yeah.
So, I'd say hang in there.
Mm-hmm.
Don't
Keep
lose
going.
patience. Keep
working
going.
it up because
You will
haven't-
be able to make a difference.
Yeah.
You just have to keep working your way through it.
And stay with your primary veterinarian who referred you, and go to the referral place or your specialty place that
Yeah.
you're going to. Because I think once you get too many people in
Yeah.
it, it just gets muddied, and then you're
Well, and watching trends, like
Yeah.
the trend of his weight
Mhm.
is a huge thing, or like
Mhm.
his body condition score or his attitude,
Yeah.
and just things
Yeah.
like that is super helpful.
I mean, we have that with our patients here. Like, we have so many doctors that, I mean, you saw a patient earlier today and was like, I don't know what he walks like normally, but he looks a little
Right.
funny to me.
Mm-hmm.
Like,
yeah, you can get
so-
complicated like
Yeah.
that. But
What else? Anybody have anything else to add in regards to that?
no.
Nope.
I hope we helped, Madison.
Yeah.
Okay.
going.
Well, if anybody has any questions, feel free to shoot them our way. We always love listening or reading and then
Yeah.
talking about them. Thank you for listening to our venting session. We really
Yes,
appreciate
thank
that
you.
as well.
Thank you.
We did that.
It was very therapeutic.
Yes.
And thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
See you then.
See you then.
Or you might be on vacation.
That's right.